Hello, everybody. Sorry for the delay. Sorry for the delay. Can you hear me? You can type yes if you can hear me. Hello? Type yes if you can hear me, please. You are welcome. Yes, thank you very much. Thank you for the waiting. Thank you very, very, very much. Thank you. Thank you for joining. Thank you very much. Thank you. Thank you for joining. Thank you. Thank you so much. You are welcome. You are welcome. This is my first live show. You are welcome to Growth with Joyce. You are welcome. You are welcome. Today we'll be talking about self-care. Self-care is a holistic practice that supports every part of our well-being, both physical, social, emotional, spiritual, and psychologically. Thank you. You are welcome. You are welcome. You are welcome. If you are finding it hard to begin, remember that basic hygiene, eating well, and resting are valid and important forms of self-care. It is a personal involving journey, and there is no right way to do it. Self-care is our own unique practice. So I will say, welcome to Growth with Joyce. You are welcome. You are welcome to our first live show. Our motto is with the future, confidence in action. You are welcome. On this platform, there are no rights or wrong questions. No right questions, no right or wrong answers. We are all here to learn from one another. And that's the only way that we can grow. Thank you very much. So before we move further, I would like you to type in the comment section where you are watching me from. Which country you are watching me from. Type in the comment section the country you are watching me from. Thank you. So type in the comment section the country you are watching me from. You are welcome, Ernest, Dandy, Hair Hub, you are welcome. Ikechukwu Emeka, you are welcome. Miraculous Olochi, you are welcome. Ernest Praise, you are welcome. So many names, including the ones I have not mentioned. You are welcome. I can see Nigeria, Enugu State from Nigeria. Type the country you are watching me from. You can also type the state if you want to. You're watching me from Nigeria. Welcome. You are welcome. Please type the country you are watching me from. Type the country you are watching me from. Thank you. Nigeria, Nigeria, Nigeria. That's good. Nigeria is a great country as well as other African countries and as well as other nations as well. I can see Nigeria. Type the country you are watching me from. Nigeria, you are glad to be here. Thank you. The country you are watching me from. The country you are watching me from. Thank you. And also, I'd like you to type on the comment section your favorite self-care routines. Your favorite self-care routines. I'd like you to type on the comment section your favorite self-care routines. We all have favorite care routines. Some people, they will like to wash their clothes. They will like to sleep. They will like to do some hobbies. They will like to do some stuff. So your favorite, some people will just want to relax and watch movies. Some people will like to go for a walk. Some people will just want their living space to be tidy. Some people will just want their bedrooms to be tidy, decluttered. Brushing of teeth, I can see that. Bath and perfume. Yes. Morning and night. That's good. So your favorite self-care routines. Your favorite: eat good food, bath, and smell nice. Dandy hair hub. That's good. Facial self-care. Wow, that's good. Every morning. Healthy eating. Good. It's not easy to eat healthily. We all want to eat, and eat, including myself. It's not an easy thing to eat healthily. Yeah, you're watching me from Nigeria. My teeth. Yes. I'm going to talk about that teeth a little bit. Our dental hygiene is so important. Dental hygiene. Sometimes we just feel, oh, I just want to brush my teeth. One of the ways you can get a good dental hygiene, when you brush your teeth, you have to brush up, down, in your tongue. The kind of brush that you use should not be too strong because of your gum. And also, when you finish eating, you can have the tooth pick. We call it toothpick back home, Nigeria. You can put it in between your teeth and just use it to bring out those extra crumbs. And also you can use the loose gloves and use it. You can also use the tiny brush in between your teeth. And also it's good to go for dental checkup every 6 months to keep your teeth healthy. And your teeth, if you have a bad tooth or bad teeth, it can affect even your cardio. So your teeth, your dental hygiene is so important. Very important. The floss, thank you for that. You've given me the right name. So you use it in between your teeth. Yes, and dental hygiene. You go to the dentist, they just clean your teeth for you. Clean it. And during that process, if you've got a bad gum, if you've got a bad tooth, you're going to see it there. So it's so important. And it gives you a good breath as well. Thank you. So our favorite self-care routine. Whether you enjoy your self-care or not. If you don't enjoy your self-care, tell us why. Because, tell us why. Sometimes it's not easy to do these self-care routines. So if you don't enjoy doing it, or the ones you don't enjoy doing, tell us why you don't like doing it. Is it because it takes a lot of time? Is it because it's not easy to remember? Is it because it's difficult? I just don't want to do it. So tell us Tell us why. If you don't enjoy self-care, tell us why. Tell us why you don't enjoy it. Because we want to know. Because it's our way of life. So if we don't enjoy, I think the best self-care is loving yourself. If you love yourself, you will take care of yourself. Thank you, Joshua. Thank you for that. Thank you. I like that. I like that comment. It takes a lot of time, but I enjoy doing it. Of course, it takes a lot of time. You'll be thinking of how I want to have a second bath, how I want to stand up where I'm watching TV. So it takes a lot of time, but we all have to enjoy it because it is what keeps us going. Have you ever imagined when you attend to your self-care, you feel relaxed, you feel okay, you feel like going to bed, you feel like just mingling with people. Have you ever noticed that? It takes a lot of time, but I enjoy it. Yes, water no dey Naija. Purpose gospel say water no dey Naija. Even if na small water, we go use am baff. One bucket, half bucket, if you wash well, you can use it. Clean your teeth. Wash the vital parts very well. Because there is nothing like you are at work, you are talking to somebody, and the person is not comfortable because of dental hygiene. There's nothing like you have walked down to work and everybody around is not comfortable. So self-care is so important. Self-care is so important. So thank you for that. Okay. So the next one is, if you can leave in the comments how you currently manage your self-care. How do you do that? When I brush at night, I stay awake and alert, and smelling nice makes me confident. That is correct. I forgot most time because of the kids, but I enjoy doing it. Yes. I understand all that if we've got young children. If we've got young children to cater for, but we still have to look after ourselves. It's not easy, even for me, and I think for others as well. It's not easy, but we have to consciously, deliberately wanting to do it. We have to create it. Thank you so much for all those comments. So let's ride on. Anyone here celebrating his or her birthday? Anyone? Do I have one person celebrating today? Anyone born on the 5th? I would like you to tag it on the 5th of March. On the 5th of March. Anyone celebrating their birthday so that we can sing happy birthday for that person? Anyone? Yes, when I take my bath, I always apply roll-on my armpit to have good fragrance. Thank you. That's good. That's good. That's good. I like self-care. It's a great motivation to start your day. Yes. Even if it's half a bucket, it is good for us to do it, for us to use it. Anyone celebrating their birthday, we want to wish that person a happy birthday. A happy birthday. Anyone? Anyone celebrating their birthday? I like self-care. It's a great motivation to start your day. Self-care boosts your confidence. 100%. Precious. I like that. It boosts your confidence. It doesn't have to be luxurious. Roll on. Clean your teeth. having a clean bath, it is good. So there's nobody celebrating their birthday. I will still come to that again. Type in the comment section, want to sing happy birthday for you. Yeah. Anyone? I always use a body spray after bathing at night because I love to smell good. Thank you. I like self-care because it will determine my environment in my dream and the office I enter in my dream. That's a good one. That's a good one. Keeping my clothes well pressed and look good. Oh, ironing. That is what I don't like. I don't like ironing. I don't know about you guys. I don't like ironing. I don't. It's so hard. It's so difficult. It's so hard. So when I wash, the machine, there's an ironing stuff there. I put it on and just do this, shake it, and hang it up. I don't like ironing. All right. So anyone celebrating their birthday? Okay. My child, Afolabi, it's a belated birthday. Oh, okay. Congratulations, Kingsley. Congratulations. Ah, Christine saying no like ironing like me. I know. I don't. I don't like ironing. I don't like it. I don't like it, but I just have to try. But it's been a while I ironed because we are in winter. So it's been a while. Been a while. All right. So thank you all. Only one person's child, Afolabi. So can you pin that for me, yeah? What's the person's name? Kingsley. If you can pin that, Kingsley. Child is celebrating belated birthday, okay? My birthday, 23rd of March. It never reach, oh. And my son's birthday, 19th of March. Okay, it's still good, it's still good, it's still good. It's still good, it's still good. That's good, that's good. That's good. Yes, before I will still announce that again in case somebody comes in. So today, let's dive into the main cocoa. So during this show, we would be giving a health check tokens to 10 people, commenters. I hope everyone has subscribed. Share the link, like, comment, subscribe. I've got a lot of people here. Everyone that is present today, subscribe. And also share the link, comment, and like, share the link. So we're going to be giving out 10 health check tokens to commenters today and 5 coordinators. So stay till the end of the show. So we're going to put a number there. It's a WhatsApp number. You're going to leave, we're going to announce the winner. So you're going to leave your bank details so that we can send across the health tokens to those people. So we're going to be doing that today because today is our first opening show. For you guys to come and join, I really, really appreciate. It shows that you guys are supporting your own. So I've got the first one is we're going to give out the growth with Joyce, the team. We're going to give out 15 tokens for health check. So you're going to leave, if you are the winner, if you are the most commenter, if you are the person that has subscribed and all that, and share the link as you are watching, share the link. We're going to get back to you. So we're going to leave a number there. where you guys can send those information so that we can send the token across. So thank you so much. So the other thing I'm going to do today is another thing we're going to be doing today, from today, is going to start from the 5th of March this month to the end of June this year, 2026. And what we're going to be doing is 3 people. So the first one we are giving students. The first token is going to be for students. If we have students in the house, type students. Students. We're going to do that. So you're going to type students. And we're going to give those tokens to the students for their health checks. And that's from Nigeria, because I can see a lot of Nigerians here. So that's to Nigerians. We're going to be giving you the 10 tokens, and for the 5 coordinators as well. We're going to be giving you health token for health checks. So the other thing we're going to be doing, we're going to be announcing, which I'm announcing now, the team which we are announcing now is for the next 3 months plus, which is going to start today from the 5th of March 2026 to the end of June 2026. I'm going to pick out 3 people. So it's going to be 3 winners. The first person, the second person, and the third person. So what we're going to be giving, we're going to be giving a very tiny, small grant to 3 people who is going to fall into this category. Business owners to support their business as part of welfare package, because I'm going to tell you guys have read my introduction. I'm just going to say it a little bit as well, because one of the things we'll be doing on this show is welfare package. So this is going to be one of them. So 3 people, they are going to follow the criteria. I'm going to put it as well there. I'll copy it and put it on the WhatsApp group as well. So the criteria, they will be from Nigeria. So the criteria will be, you'll be a small business that you are still pushing on, and it's just a tiny token from the team. So the first thing is that you're going to bring proof that you already have a business. So even if it's 1 naira, we want to put, we will know you have a business already, but the business and you dey shake small like that, you dey shake. Not be for big business or small one, and you dey shake for money. So we will give a token or equipment. So it will be, and maybe you've learned a skill. You dey look for small thing, tiny bit, Naija, tiny, to take start am or add to am. So we go give 3 people. So the criteria be say, prove that you have a skill and needs a little equipment or token to start up or upgrade. So, and on our next show, we shall let you know the process of the token and equipment disbursement. We'll let you know. So the first thing, you will subscribe to the channel. You will like, comment on our videos. Any video you see, you will watch it. You will comment. You will share to 30 people. You will share to 30 people. And our videos, you will like, you will comment, You will share to 30 people. Those 30 people will subscribe to the channel as well. So those are the criteria. So I'm going to write it down. The team will write it down. The team will write it down and they will pass across. So it will be in the WhatsApp group as well. So if I'm too fast, you will pick it up from there. So you always be on the show. Anytime we are having show, you'll be there. You comment, you do the sharing. So share to 30 people and you bring proof. Everything you will have proof. The proof of the business, the proof of the skill, what you have been doing, you're going to have proof. And each time you send the link and somebody subscribe, you bring the proof as well. So our team, we're going to handle all that. So please, no negative comments, no arguments and all that. So our WhatsApp group, we're going to be putting the number there and we're going to be communicating, just messaging. So sometimes it might take us 72 hours to reply. You just need to bear with us. So I will leave all that and we're going to start with our day. So thank you for all the wonderful comments. This is Loving. Thank you. Thank you. Thank you for from NS Praise. Thank you. Thank you. Thank you. Because we don't have a particular day yet that we will be doing the live show. So, but we're going to communicate through the WhatsApp. So everybody will know this is the day we are doing it. If there will be any changes, we'll let everybody know. So today, why self-care matters. Why is it matters? We have commented on so many things. Matter, it makes me give me confidence. Is this, is that, is that. Self-care is essential because it reduces stress and burnouts. Regular self-care helps to manage anxiety and prevents emotional exhaustion. It improves physical health. It boosts immunity. It increases energy support. It increases energy support and long-term wellness. It strengthens relationships. When you care for yourself first, you show up better for others. Yes. When you care for yourself, when you are able to look after yourself, you do your exercise, you eat well, you try and make yourself feel better within, you'll be able to care for others. You'll be able to look after other people. So that is why it's so good. It builds esteem. We have said it. It builds esteem. Treating yourself with kindness reinforces your sense of worth. Practical ways to practice self-care. Self-care doesn't have to be expensive. Do you believe that? That our self-care doesn't have to be expensive? Comment that. Comment yes or no. If you think self-care doesn't have to be expensive and also is not time-consuming, do you believe that self-care is don't have to be expensive? I will use myself as an example. When it comes to toiletries and all that, sometimes you wonder, you say, oh, why should I spend so much money? You don't have to spend so much money to do self-care. We have what they call a pound shop here. We have other shops you can buy things even 50p, 20p, all those stuff. By the time you buy a roll-on and you buy your soap, that will go a long way. The most important thing is you try and have a bath, you attend to all the vital parts, which is the first thing you shave. Because when you shave the vital parts, it helps you not to retain sweat so that you don't have any unpleasant smell. So that is the first thing. Try and keep all the other parts tidy and clean. You do all the cleaning. So that goes a long way. So by the time you apply all your toiletries, it will last longer and it will make you feel better. So those little steps that you take, you attend to all the vital parts, you do the shaving, you hardly have any uncomfortable smell. So it's very important that we attend to those parts and apply whatever we need to apply. You can do it every day. You can do it every other day, especially because of the weather. Somewhere like in Nigeria, when I go home, you see all this, you do all those bits and you feel better. When before you leave your home, you attend to your personal hygiene by having a bath, shower, ensuring all those vital parts are tidy. You will see the difference. So it doesn't have to be expensive. It can be time consuming sometimes, but if we have a routine, if it's something we do all the time, we don't have to spend a lot of time to attend to our personal care. So we're going to move further. Let me take a few comments. Hi, this is time consuming, especially skincare. Yes, I will say yes. But if you are consistent, if you do it all the time, like every day, it becomes part of you. It becomes easier. It's just something you say, oh, let me go and have a shower. If you know you take time, because some people take time, individual differences. If you take time, you give yourself extra time. If you know you are going to work 7 o'clock, you can wake up an hour before then to attend to yourself, attend to everything that you need to do. So it becomes easier. And when you do it all the time, it becomes a routine. You just have it like every other thing, like, oh, I want to go and eat. I want to eat food. That's how it's going to look like. That's how it will feel like. Yes. So time consuming. I would say when I was growing up, I had a lot of acne. A lot. When I mean a lot, it's like grass. A lot of acne on my face. Pimples. I was so, every day I'll be thinking about it. You know, as a teenager, oh, your face, your face. People are cleaning face once, I'll be cleaning 100 times because I want the acne to go. I want those pimples, I want them to run away. You know, because I didn't have the knowledge that it's just a phase, it's a growing stage, that this thing is going to fade, this thing is going to go, it's going to go off. I didn't have that. So we move on. Time consuming simply needs time to help you feel grounded, refreshed, and connected to yourself. Okay, take a short walk, do deep breathing exercise. So in terms of that, taking a walk is very good. It's one of the things the World Health Organization, they've recommended for us. That's one of the things they've recommended for us. You know, that if we take a walk on a daily basis, yeah, even if sometimes we cannot do it on a daily basis, we can try our best to do it as much as we can. It helps with our cardiovascular system, our hearts, all those arteries, all those beats. It helps us. So it's always good for us to take a walk. Let's say you are driving or you enter the bus. What you can do, you can stop few stops before your workplace or wherever you are going to. Because if you do that, you can walk, that you can use that time to walk at least 5 minutes, 10 minutes, you can use it. So it will help you because some of us drive, but we don't have to drive. You don't have to drive all the time. Let driving be a necessity, not like you should be driving all the time. Get the bus, jump on the bus, walk, do whatever you know you can do. Thank you very much for the comments. Let me take more comments. Self-care, especially skincare, it's not for the weak. I do, but the deep cleaning self are normally on free days. I just do the basic every day. Yes, that's good. If you can't fight procrastination, it will help us have a proper self-care. Okay, let's move on. So one of the ways as well is listen to a favorite song. Drink a glass of water mindfully. Let's talk about water. Water. Let's talk about water. Water is the best juice, is the best drink, is the best. One of the ways I drink water, I'm going to tell you guys how I drink my water. I wake up in the morning. Some people say it's good to drink before you clean your teeth, or it's good you can clean your teeth before you drink. I do both, whichever one comes first. I drink, there is a volume of water a man or a woman they can drink. I think the man should be about 3,000 plus liters. Same thing with a woman, but not as much as men. When you take your full glass, say 500, as soon as you wake up or later on, you start drinking water as soon as you wake up. When you wake up before 12, ensure what I do, I try my best to drink more than 1,000 before 12. Ensure again that I drink up to 1,500 or 2,000 before 4 o'clock. Yes, before that time. What am I avoiding? Too much toileting when I'm asleep. So I'll be avoiding that. So when you start drinking those water, you started filtering your kidneys already. So we might do another self-care on kidneys, but just a little bit to touch that. You start filtering your kidney already. Yeah. Daily habits. Create a calming morning routine. Limits screen time and social media. Ha! I don't know how we will stop social media. Now the social media we did, so I don't know, but we have to try. We have to discipline ourselves. Today, I have disciplined myself. I know I am touching a lot of gadgets and all that, but I said at so time, this is what I'm going to do. At so time, this is what I'm going to do. So that is part of self-care. I know we all want to find out what's happening, what's going on, but we have to try our best to limit screen time and social media. That is the truth. We create time for it. We say, this is time I'm doing this time I'm doing that. So that will help us. Keep your space tidy. Yes, we all have said that. Maintain a consistent sleep schedule. So our main what we're going to really deep on today is sleep hygiene. We're going to do all that. Avoid checking work emails. Yes, at night. Yes, yes, yes. I want somebody to type on the comment section, when you finish work, you at home, you are still checking emails, especially if you work for people. If you work on your own, sometimes you want to do a follow-up. But if you are not a self-employed, you still have to create that routine. And you work for people, an employee, you get home, you still want to check what is happening, what is happening. I don't do it. As soon as I leave the door, because I work for people, so as soon as I leave the door, that is it. The only time I will go there is if I'm going to do something that is not related to work. Because you have to create that routine. You have to create that routine. Reduce time spent with negative or draining people. Draining people. So that is part of self-care as well. Reduce it. If somebody go give you bad energy, reduce them. It's so important that you reduce it. So let me take one comment. I drink as much as half bag of pure water, which is 10 sachets even more. But you have to check the quantity, because I cannot go on Google now. If half of that sachet, if it's more than 3,000 plus, so you check it if you're a woman and a man. Because if you drink too much water, it starts your electrolytes. That's another topic. So let's leave that one. But it's not good for you to drink too much, except the doctor has asked you to do that. Because if you drink less, there's a problem. If you drink too much, there's a problem. There's a way I drink. If I know I'm going to drink up to 3,000, my first cup of water in the morning, what I do, I add a pinch of salt. A pinch of salt inside the water, just a pinch in the morning. So what that does for me, it helps my electrolytes, it helps everything to be balanced. But I don't do it every day, because that's why sometimes when you drink too much water, it's as if you're having a spin. Yeah. So watch the quantity you drink. Quantity of water, not just only the real water. You drink tea, you drink all those are part of it as well. Thank you very much for all the comments. Work should end at work. Yes, so Joshua, work go end for work. But the only thing is, if it's your own personal business, that's another thing. And if one is not making money, you want to check your WhatsApp, you want to check your messages. So that's understandable, but still, you still create time. Yeah. All right. Too much of everything is not good. Yes, so of course, creative outlets. You can do painting, it's part of self-care. Way of promoting gardening, cooking. We all love cooking. It's part of self-care as well. You can cook. Some people just want to cook to keep them occupied, their minds. Music is part of it. You listen to music. Some people like listening to music in the morning. Even writing is part of it. How to build self-care routine. Yes, the routine. Start small. Start small, small. No be gidi matter. Start am small, 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 small. Choose one or two simple habits you can maintain. You cannot like everything. It's just that you have to do everything, but the ones you can maintain, just choose little. Schedule it. Treat self-care as a non-negotiable. Just like, I must eat, hunger dey beat me. That is how we should treat self-care. Identify your need. Ask yourself, what do I need right now? Because everybody got their needs. Some people will say, I need to think of how I'm going to do my sleep. I need to think of how I'm going to do the cleaning. I'm going to do the laundry, things like that. So you have to think about what you need right now. Be flexible. Don't be hard on yourself. Your needs will change, and your routine can change with them. Yes, if you still have little babies, your routine, and when your children start growing up, it's another routine again. So follow your pattern. Do what will make you happy and convenient for you as well. All right, so our main thing in terms of this healthcare, self-care today is, let's talk about sleep hygiene. Type on the comment section how many hours you dey sleep. Type there, how many hours you dey sleep every day. How many hours? How many hours? It's not easy to get sleep, especially as you get older, especially if you have a lot of schedule, and if you have your little babies, children, little ones that you need to care for. How many hours do you sleep on a daily basis? Students, let's talk about it. Student, parents, night workers, we do shift work. Today we did day, next tomorrow we did night, next tomorrow we did day. All they do the system. So, how many hours you dey fit get? How many hours? Share in the comment section. How many hours do you get each day? And why sleep is important for your mental health. Type it. Self-care is most important. Small, but consistent. That's good. Miracle. That's good. You dey try. I can sleep all day, but at night I sleep less. Dandy hair up. You get to change your routine. Oh. You try and change your routine. I don't know the kind of work you do, but if you sleep too much during the day, you find that you cannot sleep at night. So you try and reduce it, but I'm not sure the kind of job that you are into. So that might be one of the issues. But we have to try. And also, what changes you want to make to improve your sleep? So type in the comment, wow, Chinweweka, when stressed out, I sleep for 9 to 8 hours. That's good. 6 hours, Precious, Kingsley, 6 hours. It's not bad now. It's good. Well done, well done, well done. Keep commenting, share the video, share, comments, share the link. Share the link. Anyone in the house that is celebrating birthday today? Anyone in the house celebrating birthday? If you're celebrating your birthday, anyone? I know there are some people who said they are celebrating their birthday in March. So, but it's today one we want to talk about. I work best at night. Okay, that's good. That's why. And I'm into wigging and I ventilate closures and frontal. That's good. Okay, but still, Dandy Hair Hub, still try to get sleep at night because I'm going to tell you what sleep at night does for you today. Why sleep matters. Quality sleep supports mental health, stabilizes mood. If you notice, if you don't sleep for some days, it will be as if you are going like this. Be like say your eye they turn you, or be like say they do things, you're not doing things correctly. Your mood will be high, as if you've drank some vodka. If it's too much, you see yourself. Yeah? Quality sleep supports mental health, stabilizes mood. Our mood matters. When you see yourself say you dey vex at times, you just dey vex because you've not had good sleep. It's part of it. And strengthens cognitive function. The sleep you get at night. There are certain times at night that all those your cells where you don't work, they go dey form back, they go dey do well, they go dey reblame, you go dey remove the dirty one, the new one go dey come. It happens at night. It never happens during the day. It happens at night. And it has a specific time window that it happens. Poor sleep increases the risk of anxiety, depression, irritability. That one is the cocoa. You find yourself, you go dey vex one kind because you didn't get, either you no get sleep or enough sleep. Please, I hope it's not an issue if I can't sleep during the day, even when I'm stressed out, but I wait till night to sleep. Now, night's good pass. And sometimes the thing is, when we are stressed, if you've not watched that my video, I'm going to release a money video very soon. Money video. Waiting money and mental health, how do they play? This thing come inside. So it means if you have issues, you are stressed, your sleep will be affected. But you have to try. But if you have a routine, it will play a big role. Because when that time comes, the brain has already registered that this is the time I need to sleep. You will fall asleep somehow. It's only when you don't have routine, so which we're going to talk about, and difficulty in concentrating. What happens when we lack sleep? High risk of depression and anxiety, problems with cognitive, which is memory, focus, and decision making. Increased vulnerability to mental health disorders such as post-traumatic stress disorders. It increases it. So, how do we improve our sleep? How we go take manage all this sleep? Because so many things is happening. So, how do we do that? If you've not subscribed yet, please subscribe. Please share. Please comment. Share to other people. We mentioned two things. What we're going to do after this show. 10 people that comment very well, share and all that. And 10 and 5 coordinators. We're going to give them a tiny health token today. Students, Ninja, we're going to do that. And the other thing we're going to do, which is going to start today till June 2026, 3 business owners, the ones when it shake, they go don't get business already. But now tiny token or tiny equipment where they is related to what the person they do, or the skills where somebody don't learn, it wants to upgrade, or it just want to start, just a tiny token. So myself and my team, we go get back to now for the other one. What we go do? So the thing is, you will share the videos to 30 people and they will subscribe. Every time we are doing shows, you will be here. For those time, you'll be present, you'll be participating like this. And all the videos I'll be bringing out, you'll be liking it, you'll be commenting, you'll be sharing. So that is the criteria for that. But it's a tiny token. So I hope una go appreciate that one. You know, say we just start. So we take our one appreciate to now for una to come today. So make una spread the news. We don't know who go be the lucky 3 people. So first person, second runner, and third runner for the other one. So that one go take over 3 months for us to actualize them. So let's continue. How to improve sleep. Sleep na the cocoa. If we don't sleep well, we not go fit dey do things well. And sometimes you go say, I still young, I'm still young. I dey run around, they run around, they run around, they run around. But you forget that this thing, it keeps building up inside. They build up. Just like you dey drive car every day. You dey drive car every day. You don't service it. You don't do the motorable stuff. You don't do what we dey call MOT for this side. We do it every year when you go and maintain your car and all that. They will come give you badge, say you pass. If you don't do that, the motor they break down after. That is just how the body is. So sometimes we say, I still young, make I dey run, they go, I still young. It is what you start doing, the routine that you start doing from start. Now the thing go help you. Now it go help you. And sleep. Sleep. Now the cocoa. Sleep. My job, I'm a psychiatric nurse. They call us mental health nurse. The only way a patient can get fully recovered when patient is in crisis is only when that patient start getting sleep. If you don't sleep, the person sleep, you know they well. Whether you give that person the whole medication, the patient will never get better, except the patient start getting rest, sleeping. Then you see the body starts coming back again. I have seen over the years high profile people when lack of sleep, over work, they didn't have time to rest. They will just break down, finish. Then sometimes see people just slump like that. High blood pressure, wetin dey cause am? Apart from, that's another topic, so we're not going to discuss that. Apart from is inherited, you have to relax this body. If you work, if you're at work, you will see the difference. And when you are not doing anything with your pulse, when you are working, your pulse will just go up. And when you are stressed, blood pressure, bam, it go up. So sleep is vital. Please, what is the exact time that the body do factory reset itself? I'm going to find out that for you. I can't give you the time at the moment. I'm going to find that for you. So if you come the next show, who be the person? Kingsley, ask me. I go tell you. But you get the time when it happen. Please, and what about those who fortify their sleep at night to work and then sleep for 4 hours in the morning and wait till the next morning to sleep? Good. Yes, use myself as an example. When I go for night shifts, I do nights, that depends, maybe 2, 3 nights together, depends. And when I do those shifts, I come back. You're expected to have 1 hour break, 1 hour. So because of the kind of nights that I do most time, you see me jumping up and down. So when I come back, I try to get sleep so that I can go the next day again. But the truth is, during that time, the body doesn't really get the kind of sleep it's supposed to get. So when I finish night, it's as if I've taken break for days. I will just be sleeping to catch up. But it's part of my job. I have to do it. But at the same time, I don't have to do it too much. So let's see how to improve our sleep. So this is the first thing we have to do if we want to improve it. Keep a consistent sleep schedule. Just like the question Obiora has asked, say, if you are not sleeping, you work at night and all that. Yes, because you don't work every day nights, most people don't do nights every day, but some people do. So that's another topic of its own. But when it's time that you are not doing nights, if you have that schedule, your brain will fall again into that schedule. You just need to create the routine. Any routine you create for yourself, your brain follows it. That's how it goes. You just follow it and you start doing it. You just create that routine. You start following it. Just like, oh, I'm supposed to be doing this thing every Wednesday. You see yourself, you remember every Wednesday. So it's the same pattern. It's just a routine. Avoid screens before bedtime. Keep your room cool, dark, and quiet. Stay active and get natural sunlight during the day. We that are here, we don't get light when it's winter. So we have to manage it the way we see it. But you guys, you got a lot of sun, you got a lot of vitamin D. Seek support if mental health challenges affect your sleep. Some people sleep with medication. For me, what I will say, the only time to use medication is, let's say you are not well. Somebody is going through mental health issues or even physical health issues, and they need to care for you. Then you can say, you can take medication so that they can do your treatments during that time and you'll be all right. But if you're not going through any physical health issues, if you're not going through any mental health issues, I would say create a routine. When you create a routine, your body follows it. If you break it in between, your body follows that breakage again. So what you can do when you finish that, start again, start the routine. Positive thinking and healthy routines around sleep. Do you know you can tell your body you want to go to sleep? You can just say it from your mouth. There is power in the tongue. In our mouth, power there inside, but we think say na play. Power. Just like you will say to yourself, the day is going to be a good day. It will actually be a good day. It will be a good day. Same thing with sleep. Every day if you say to yourself, I'm going to get a good sleep, I'm going to sleep well, I'm going to wake up refreshed. It's just positive minded and it's going to work. It does work. I will sleep well. When you pray at night, when you pray, when you are doing stuff, you can say, I want good sleep. You have to be positive minded. You say it to yourself. It's more than medication. Not that when you are well. That's what I mean. It's more than medication. Dandy hair hub. I dey see you plenty times. So really? So I can tell myself that I want to sleep, then the sleep will come. Yes. You have to be positive when you are saying it. Just like you are positive, you say, I must. You see that I must when you dey talk. You dey do unto yourself. Now positive affirmation. Positive affirmation. You believe in it. It works for you. Positive affirmation. Start trying it. Start doing it. Just like you say, I want to do this. I want to go to school. I want to be a graduate. I want to read this. I want to do that. So, you are positive about it. You take action. You take action. What is your action? It is the routine. You start the routine. You start that routine. You have a routine. You keep the environment. You declutter. One of the places that needs to be decluttered is where you lay your head. Don't keep all those giddy things, chaka 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 chaka. Nigeria say chaka chaka in your bedroom. You don't need them. Declutter your bedroom. Put bag here. Put bag there. Put bag there. Throw it. No. Declutter where you lay your head. You will see the difference. You will see the difference. You close your eye, positive. You act it, you act towards it. You create the routine, you create the environment for it. If not even one room you dey, you will keep them decluttered. The things we no need, forget them. We're not supposed to dey put the things we no need, put them away. When your bed, you lay that bed well, you keep the environment well. Keep them clean. It doesn't have to be expensive. Just keep them clean. Declutter. Attend to your personal hygiene. You will see the difference. Even when I tell myself I want to sleep, I close my eyes up. 2 minutes, I find myself pressing my phone. That is one of the things we have talked about. He said, do away with phone. Now, social media time we dey, but still, we have to have what they call control. Now, control be the thing to be able to do that for yourself. Same control, you will say, I'm not spending anyhow. I'm not doing this. I'm not doing that. I'm not doing this. It's the same thing. You have to have that. That phone, even if you be social media person, when time come, put them out. The people who you still they find out, they themselves, maybe they sleep. So try your best. Create that routine. It's routine you need. The brain follows routine. It follows routine. That's how it works. Now, routine. I sleep without light. If light is on, I can't sleep. Yes. Some people, they can't sleep without light. Some people sleep. It all depends on what works for you, but create routine. You only need routine. Ma, I work remotely. What about time zone? And I still have to work here for Nigeria. Yes. I don't know whether you dey work every day, but you go try your best. All right, so make we go. Positive thinking and healthy routines around sleep can make a powerful difference. Yes. Anyone celebrating birthday today? Anyone decluttering after this class? Yes, so important though. Wetin we no need am for there. Na im be self-care, promoting self-care. Promoting self-care get to do with physical, emotional, psychological, spiritual, all these things na part of self-care. It has to do with all that. You no need anything. Keep your time everywhere tidy. Routine na routine be routine. Routine na routine. But sometimes you will break the routine. It's not a problem. But once your body don't get used to routine, you break am. If you start again, you go see say e go work. Although there are times you can't sleep, but I'm sure it's not every time that it happens. Sometimes our work dey cause am. Like some of us, wetin we don't mention. Not sleeping is like hitting a wall. Effects include, thank you, Kingsley, fatigue and low energy, poor concentration and memory, mood swings and stress, weakened immunity, risk of chronic disease. You don't finish this show for me, Kingsley. You don't finish am. It's just what we are trying to do here is we just want to continue the awareness, the enlightenment to the enlighten ourselves, more awareness of what is. We already know them, but sometimes we don't put importance, we don't attach importance to them. We think, I know say easy, especially we have to go to work, we have to do this, we have to do that. There's no lights in Nigeria, there is no this, there is no that. But little things that we do, little step. We don't have to be hard on ourselves. Every property should have a place. Yes. Ernest, thank you, ma. Thank you too. Thank you. Anyone celebrating birthday today? I'm surprised say nobody they celebrate birthday. All right. Okay. So let me see if I can do this. Okay, so let me see. Okay. Okay, let me put this. Okay, I don't know if you can. Can anyone see what I have sent? Not sure, I don't know. If not, we'll put it in the WhatsApp group. So we are going to be putting in the number, they will put the number there. Yeah. So let's continue. Are we enjoying the show? Type in the comment section if we're enjoying the show. Thank you very much for your patience. It's our first show. We want to be seeing more of all of us. We want to see more of all of us. So it's our first show. So you tell me if you enjoyed today's show. We are still on it. And also type in the comment section what topic you like us to discuss. So myself and our team will put our heads together and we'll pick one and we will discuss it. So we have said before what this show is all about, what Growth with Joyce is all about, is in the first introduction video. So we're going to be doing live shows, hopefully every week or every other week, but we'll try our best. And we're going to be doing videos on a weekly basis. We're going to be throwing out some videos. Part of this show is welfare. There's a welfare package. It all depends on what's happening and what we are doing. Yeah, and other good stuff. So be part of the community and share, tell others what is happening here. And we are the only one that can make this community grow. And we are the only one that can make this enlightenment, what we are doing here, for other people to know and to get to know. So the key thing to take away today: sleep is not a passive activity. It is a vital process that protects your mental health. That protects your mental health. So, what I will say to us: prioritizing high quality sleep strengthens emotional balance, cognitive function. We have all mentioned it here. Chronic sleep deprivation, on the other hand, can significantly affect our mood, thinking, and overall our well-being. So let me read some of the comments. Let me see. Please, let's discuss more about depression in the society. It's really, but nobody is real, but nobody agrees they are depressed. Let's discuss how to tackle it and how to put through. And since you are I am a nurse. The doctors, we have what they call, the doctors, they deal with what you call the aspect of psychiatry where they call the nature and the degree of the disorder. So they deal with the nature. The nature can be depression, the degree, the extent, and other stuff. So I'm a nurse. I give support to challenging patients who are going through challenging times, suffering from mental health disorder. So I'm a nurse. I can give you the supporting aspect. So we're going to look into that. Myself and my team will look into that. So I can give you the supporting aspect, the way we support them. I can give you like a superficial stuff as well. Yeah. Yes, please. Can you talk more on depression? Okay. Depression. Some people might not be depressed, but some people classify clinical depression as anything, somebody not happy, somebody not come out for house, as depression. It has a degree, as well. Yeah. So I can briefly talk about it, but the support aspects, yeah? So we'll look into that. Sleeping is good, but sometimes we come out with pain. All right, Kingsley, you come back with pain. Like you make you explain that one small. Lost a friend through depression. Yeah. So I'm sure the friend was going through the clinical aspects, because depression can even lead to psychosis. It can lead to where people will be. Sometimes you go see some people where things don't too happen, they're going to talk by themselves. They go that fine, you all solo quiet sometimes, but when it becomes too much, now there the depression they enter. Then some people will even be going through psychosis as well. I mean, they will be hallucinating and all that. So, yeah, sorry about that, Obiora, about your friend that's because they didn't catch it on time. If you research on depression, you will see it has different stages. They didn't catch it on time. Sorry about that. Sleep is good, but sometimes we came out with pain. Okay. Wow. So depression has degree. Yeah, so you go see now step by step before you come really see say this person, they will come and diagnose the person as clinical depression. You don't just be in low mood and they say you are depressed. No, people just use the word, oh, they are depressed. Oh, they are depressed. No, you get to a certain level, then the doctor will not diagnose you that you now have depression. It gets category like that. You know, just high low mood depression. No, 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 no. That person that passed, they didn't catch it on time. Yeah. I'm enjoying this teaching. I'm not good at watching live session, but this teaching has glued me to my phone screen. All thanks to you. More are coming. More are coming. More are coming. Dandy hair hub. More are coming. So we'll soon be rounding up. We'll soon be rounding up. Thank you so much for today. One of my friends, Sissy, almost got depressed. We thought it was serious, but Jesus saved him. Sweet Sissy, sending you love. Love from Growth with Joyce. Love from our team. So, love from us. Love from us. Yes. Okay. So, thank you so much. Thank you so much. So, we'll be rounding up. If we can put on the, what's it called, type the, yeah, we're going to be sending across the number. Yeah, yeah, if we can type it there, please, the mobile number that they will send across their details. So for today's show, we are giving out 10 health check tokens and 5 health tokens to coordinators and students, those students, and yeah, for health check tokens. So you're going to leave your number, um your bank details and all that. Yeah, please, now, what causes high blood pressure and how it can be prevented, and also to avoid blood sugar and stroke. Yeah, that's another topic. We are going to look into it. I can touch on that as well. I can touch on. Sometimes it can be biological, means say they your family, they your history, but you can actually prevent it, even if it's in your history, just like type 1, type 2 diabetes. So you can actually prevent it. If you know you have some disorder or disease in your family, you can prevent it from happening to you, and as well as other life challenges it can causes it as well. Blood sugar, same thing. If you have high one, which leads to diabetes, if sometimes you can have it in your family as well. So if you look after yourself, you might not have it. And also you can have type 2 as a result of us causing it to ourselves. Depends on what we eat, especially things that contain sugar. Yeah. So all those little stuff, we're going to look into it as well. This class is very great. Thank you, Joshua. Thank you. Anything else? Anybody? I have really learned a lot through this teaching today. Thank you. Thank you so much, everybody. So we're going to be closing in the next 3 minutes. We have spent a lot of time. Thank you, Dandy Hair Hub. Your address done dey my head already. So nobody they do birthday today. No one. Ah, okay. Wetin I go do be say Kingsley, make I look na Kingsley. Kingsley say pikin, belated birthday. So Kingsley, even if you no win, I mean say win, come at the winners. You no be among the winner. You are not among the winners of the 10 people. For that belated birthday for your son, Afolabi, you will join them. So you're going to get a health token for your son. Yeah, Kingsley. Because I think I put that. How many Kingsley do we have? We'll check. But the one that's documented his child belated birthday. So we're going to give out, you'll be included with those people. So thank you so much. Thank you, everybody. You'll be included. So they will become, because I was looking for somebody who is doing his birthday today. But unfortunately, no one. So we're going to give it to Kingsley's son. So Kingsley's son, we wish you happy birthday. We wish you good luck, long life, and prosperity. Is Kingsley still there? Please, can you type in the comment section that that you heard me? Yeah, Kingsley, that you heard me. So we're going to give your son a health token as well. So it's going to be among the 11th people. So the team, Growth Rejoice team, they're going to get across to you guys. So after we have checked everybody, then we know the winners for today. So hopefully, when we started already the other one that we said we're going to do, you might be the lucky winner. So we're going to have the first runner, the first winner, the second runner, and the third runner. Yes, Kingsley, happy belated birthday to your child, Kingsley, and congratulations to you. Good. So is Kingsley, yeah, is truly coming at the right time. I love the show. Okay. So Kingsley, I can see you. That's you. Yeah. So thank you so much. So you'll be among them. Even that's for your son to do a health um health check token will be given to your son for his birthday. Thank you. Thank you. Thank you so much. So thank you so much, everybody. Thank you. So it's like I put too much stuff on this chatting page. So what I have sent, I don't know if you guys received it. Can you type in the comment section before I log off to tell me if you guys received the message that I sent, please? Uh, Thank you so much. I should go into full-time lecturing. I have a friend who is a doctor. I mean, doctor of book. She is so smart. She is so intelligent. She is a nurse, and she is so smart. She's so smart. So, and she's a doctor. She has always been telling me, Joyce, come and join me. Come and join me. I don't know yet. I don't know. Thank you for that. I will look into it. Thank you. Thank you. Thank you. So, did you guys receive the message I sent? I think it didn't go through because I don't know. Maybe it's too much. So, we're going to post it on our WhatsApp group. Yeah, thank you. So I'm about to end the show now. Thank you so much. Thank you for coming. Thank you for all the comments. Thank you for subscribing. Thank you so much. I appreciate. Naija no dey carry last. Thank you. Thank you. If you want me to do Pidgin English one, now go tell me. We will do Pidgin English one. Then we'll discuss some things. So now go tell me full Pidgin. Thank you. Thank you so much. Please, to all our audience, in the next 30 minutes, kindly check the comment section here to see if your surname came out on top. Okay. All right. Thank you. Thank you. Thank you for joining this community. Thank you for all the prayers. Thank you so much. I appreciate. I appreciate. Thank you so much. There's a message in the comments section. So check. Can read it out. Please, to all our audience, in the next 30 minutes, kindly check the comment section here to see if your surname came out on top. So that's the message. Thank you. So Growth with Joyce, the team will get back to you. Thank you so much. Thank you for all the prayers. I appreciate. Thank you. Bye-bye. I end the show now.